Constipation refers to infrequent or difficult bowel movements, often defined as having fewer than 3 bowel movements per week. It can be accompanied by hard, dry stools that are difficult to pass, as well as a feeling of incomplete evacuation. Constipation can be occasional or chronic and can affect people of all ages. Symptoms of constipation: infrequent bowel movements, fewer than 3 bowel movements per week. Difficulty passing stools, straining or pain during bowel movements. Hard or lumpy stools, stools that are hard, dry, or small. Sensation of incomplete evacuation, feeling as though the bowel has not been completely emptied. Abdominal discomfort or bloating. Excessive gas. Causes of constipation: there are many potential causes of constipation, including 1. Dietary factors. Low fiber intake. Diets lacking in fruits, vegetables, and whole grains can lead to constipation. Dehydration. Not drinking enough water or fluids can make stools harder and more difficult to pass. 2. Lack of physical activity. Inactivity or a sedentary lifestyle can slow down the digestive system, leading to constipation. 3. Changes in routine. Travel, changes in diet, or alterations in daily schedules can disrupt bowel regularity. 4. Ignoring the urge. Ignoring the natural urge to have a bowel movement can lead to constipation over time. 5. Medications. Certain medications can cause constipation, including opioids, pain relievers, antacids containing calcium or aluminum, antidepressants, iron supplements, antihistamines. 6. Medical conditions. Irritable bowel syndrome (IBS), hypothyroidism, underactive thyroid, diabetes, Parkinson's disease, multiple sclerosis, pregnancy. Hormonal changes and pressure on the intestines can cause constipation during pregnancy. 7. Aging. As people age, the digestive system tends to slow down, which can result in constipation. 8. Mental health factors. Stress, anxiety, or depression can affect digestion and bowel movements. Diagnosis. To diagnose constipation, healthcare provider may ask about your symptoms, diet, and lifestyle. Perform a physical examination, possibly including an abdominal examination. Recommend a rectal exam to check for abnormalities. Order blood tests or imaging studies, such as X-rays or colonoscopy, if an underlying condition is suspected. Treatment. Treatment for constipation focuses on relieving symptoms and addressing the underlying cause. Approaches include 1. Dietary and lifestyle changes. Increase fiber intake. Eating more fruits, vegetables, whole grains, and legumes can help bulk up the stool and make it easier to pass. Aim for at least 20 to 35 grams of fiber per day. Drink plenty of fluids. Staying hydrated by drinking enough water can help prevent stools from becoming hard and dry. Regular physical activity. Exercise can stimulate bowel movements by promoting healthy digestion. Establish a regular bathroom routine. Setting aside time each day for a bowel movement, especially after meals, can help train the body. 2. Laxatives. If lifestyle changes aren't enough, Over-the-counter laxatives may be used to help relieve constipation. Types of laxatives include bulk-forming laxatives. These add bulk to the stool, making it easier to pass, e.g., psyllium, methylcellulose. Stool softeners. These help moisten the stool to make it easier to pass, e.g., docusate sodium. Osmotic laxatives. These help draw water into the intestines to soften the stool, e.g., polyethylene glycol, milk of magnesia. Stimulant laxatives. These stimulate the muscles of the intestines to move the stool through, e.g., bisacodyl, center. These should be used sparingly as they can cause dependency. 3. Prescription medications. In chronic or severe cases, the doctor may prescribe medications to help manage constipation, such as lubiprostone, linaclotide, or prucalopride. 4. Biofeedback therapies. For individuals with pelvic floor dysfunction, biofeedback may be recommended to retrain the muscles involved in bowel movements. 5. Surgery. Surgery is rarely necessary but may be considered for severe cases of constipation caused by structural issues in the intestines or rectum, such as rectal prolapse or intestinal blockage. Preventing constipation involves maintaining healthy habits, including: eat a fiber-rich diet. Include plenty of fruits, vegetables, whole grains, and legumes in your diet. Stay hydrated. Drink at least 6 to 8 glasses of water a day. Exercise regularly. Engage in physical activities such as walking, swimming, or yoga to keep the digestive system functioning. Don't ignore the urge. Responding to the body's natural signals can help maintain regular bowel habits. Limit constipating foods. Cut down on processed foods, dairy, and red meat, which can contribute to constipation. When to seek medical help, you should consult a healthcare provider if constipation is severe, lasts longer than 3 weeks, or is accompanied by unexplained weight loss, blood in the stool, or persistent abdominal pain. There is rectal bleeding or unexplained changes in bowel habits. Symptoms worsen despite treatment. Conclusion: constipation is a common condition that can cause discomfort but is usually manageable with lifestyle changes, such as increasing fiber intake, staying hydrated, and being physically active. If constipation persists or is accompanied by alarming symptoms, it's important to seek medical advice to identify any underlying issues and determine the best course of treatment.